I want to speak to a global health crisis today. The current system is definitely broken, but Western medicine is not the enemy. Our current mindset is the enemy. We live in a world where patients are looking for the next pill and do not understand the functioning of their own body. We have an increasing rate of chronic illness that will not be remedied with any quick fix. Effective management of our conditions requires dedication to habit change. But that's not how we've been programmed, especially when it comes to our health. So I want to ask you a few questions. What is one thing you could be doing differently in your daily life that would have a positive impact on your well-being? Maybe it's eat better. Maybe it's getting more sleep. How many of you would benefit from more exercise or self-care? If you followed through on that one thing consistently for the next 90 days, how might your life be different? How might it impact your energy, outlook, productivity, and relationships? If someone was holding you accountable to integrating that change, how much more likely would you be to actually follow through on that habit change versus do it alone? Up until this point, most of us haven't experienced this level of dedicated support. So what's the reality of this change? 70% of our deaths are caused by preventable chronic diseases. 7 out of 10 of us will die from something that's preventable, based on that statistic. And currently in the US, 45% of our population has a chronic disease, and that's rising as well. And it's not just the physical symptoms. Data shows that our social and emotional needs are not being addressed. This excerpt from a New York Times article on Crohn's disease illustrates the personal impact. It's hard to be a good employee when you need extended time off. It's hard to be a good friend when you cancel plans last minute. It's hard to be a good partner or parent when you barely have the energy to get out of bed. No matter how much you try to explain, people expect you to get better already. And when you don't, they resent you, consciously or not. Some relationships end entirely, casualties of an unfair and misunderstood illness, while others get stronger as you find your true support system. But most of all, your relationship with yourself changes. You grieve a version of yourself that doesn't exist anymore, and a future version that looks different than what you'd planned. So that's the tough news. The good news is that we know the next billion-dollar blockbuster drug. It's habit change. When you boil it down, habit change would prevent 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancer. The answers are simple, but helping people towards sustainable habit change often requires immersive coaching. Our caregiver system needs a new kind of caregiver, a caregiver who provides compassionate, ongoing support for sustainable habit change, a caregiver who inspires your intrinsic motivation. This kind of care is precisely what health coaches provide, and all of us could benefit from one. We've trained over 20,000 coaches, and we'll train hundreds of thousands more to help the tens of millions of people who will benefit from health coaching. There's one final point that I want to share with you that has really impacted our future vision. In tracking our own student journeys, we know our education platform serves not only a vocational purpose, but as an effective ecosystem for learning vital life and health skills we all need: nutrition, habit change, and personal growth. Health is the element that unifies all of us, and it's time for a paradigm shift. We recently acquired $8 million with Rethink Education, and we're committed to creating change at scale. If you see ways of partnering on this mission, my name is Eric Nooner, and I'm the CEO of Empowered Education.